How to properly fill out the newborn screening card. Newborn's birth date and collection date and time. The newborn's birth date and time, along with the collection date and time, are crucial pieces of information. This information about the newborn is critical for blood specimen analytics and for identifying the correct infant. Tests are specific to the child's exact age in hours and when the specimen was collected. Write the date and time the child was born, along with the date and time the specimen was collected. Note, you should use the 24-hour clock or military time. The age of the infant can change the way results are interpreted. If the date and time are wrong, it could negatively impact results. It can make the difference between a result being normal or abnormal. Mother's/legal guardian's information. This information helps our program provide necessary identifiers when contacting healthcare facilities and/or providers. In rare cases, we may use this information to contact the mother or legal guardian to coordinate care for babies with abnormal results. If we need to contact a parent about a screening result, we contact the person listed here. A common misconception in adoption or surrogacy is to always list the birth parent. In the case of an adoption or surrogacy, use the name of the mother or legal guardian who will be taking the baby home. Do not write the birthing parent if they are not the legal guardian. Instead, write the legal guardian's name here and fill in the new surrogacy/adoption bubble. Write the mother/legal guardian's last name and first name. No middle name. Note: legal guardian's last name should be their current last name, not a maiden name. The new mother/legal guardian's birth date field helps the newborn screening team provide identifiers when calling a hospital to obtain protected health information and/or report results. Fill in the bubble if the birthing mother or birthing person received steroids within the 7 days prior to giving birth, and indicate the last date when they were administered. Please note, in the case of same-sex legal guardians, choose whomever is the hospital guarantor for the first screen, and use the same information on the second screen. Some birth mothers prefer to remain anonymous, especially in closed adoptions. If they wish to be anonymous, do not list their name on the card or anywhere else. If they don't mind being named, you can include their name in the miscellaneous section of the card. Birth facility, submitter ID, and follow-up care. Birth facility helps us identify the correct infant and know who to bill. Write the facility ID number for the hospital or the birth center where the infant was born. Reference the card's yellow flap. For a list of common birth facility submitter ID numbers, birth facility key takeaways. For a complete list of submitter ID numbers, visit www.doh.wa.gov/nbs-ID. Home births attended by a midwife. Write the individual midwife's ID number (M) number. Use code X9999 for babies born out of state or out of country. X8888 for babies born in transit or outside a birth facility. Use code X0810 for babies born at home attended by a family member or the birth attendant is unknown. Submitter ID. Write the ID number for the facility where the specimen was collected. Fill in the bubble if the submitter is the same location as the birth facility instead of writing a number. Note: for midwives delivering at home, use individual M submitter codes. For midwives delivering at birth centers, use AB submitter code. Test results are shared with the submitter. This number is also used for quarterly quality and compliance data. Follow-up care. This facility will be contacted when abnormal results require follow-up. Write the ID number of the facility where the child will receive outpatient care. Instead of writing a number, fill in the bubble if the location is the same as the submitter.
Special occasions.
If parents have not selected a primary care physician, PCP, or follow-up care provider, leave this field blank. If it's blank, the follow-up team will call the birth hospital to try to find the correct provider for follow-up. If the parents have selected a PCP, but you're unable to provide a submitter ID, write either the clinic name and city or the doctor's name and city in the miscellaneous field. Gestational age, birth order, and birth weight. When the newborn screening team analyzes abnormal results, they may reference the infant's gestational age and birth weight. When listing the gestational age, write the gestational age at birth. Do not write a corrected or adjusted age, as this could make it more difficult to analyze the specimen and interpret results. Filling out the birth order section helps us correctly identify the baby in case there are multiple births. Fill in the correct bubble for the baby, and when filling in the birth weight, use grams and refrain from using any decimals. Race and equity. Information about the child's race is required by the Board of Health. It is used to look at disease trends within populations. This data does not influence quarterly newborn screening quality and compliance data. Fill in all the bubbles that apply to the infant, including both biological parents. We encourage you to ask which races apply to be as accurate as possible. Special considerations for the infant. The newborn screening demographic cards include several special considerations. These can affect how the screening team interprets the test results. They are all important to know when we are determining if a specimen is normal or abnormal. Fill in the NICU bubble if the child is, or will be in the intensive care unit or special care nursery. Fill in the HA/TPN bubble if the child received hyperalimentation/total parenteral nutrition or intravenous supplementation, including amino acids, in the last 24 hours. Please note, excluding antibiotics, it is ideal that the specimen be collected before the baby receives these products, even if the baby is less than 18 hours of age. Collecting the specimen after these products have been administered may lead to false abnormal results. Please be sure to fill in the appropriate bubble if the infant has received any products for correct result analysis. Fill in the steroids bubble if the child receives steroids in the last 7 days. Fill in the antibiotics bubble if the child received antibiotics in the last 24 hours before the specimen was taken. Fill in the meconium ileus bubble if the child has been identified as having meconium ileus, which can be an indicator of cystic fibrosis. Fill in the transfused bubble if the child received red blood cell transfusion. Write the date and time of last transfusion, using military time. Refusals. We screen all newborn babies in Washington, which is mandated by state law. Parents can only opt out of the screening if it conflicts with their religious beliefs. If they make this choice, make sure they read the refusal of testing statement on the back of the screening card. Text is available on our website in other languages for parents to reference. If the parents refuse the screening, you should still complete all the demographic information on the front of the card and check the box indicating refused. Then have the parents sign and date the back of the card and send the card back to the state lab. Please note, if the parents refuse to sign the refusal, please indicate this in the parent's name line with staff initials and date. The birthing hospital or attendant is responsible for returning the signed refusal. Mail it to the state laboratory right away, just like a blood specimen. Thank you for helping us reduce the error rate on newborn screening cards.